Good afternoon. Allegheny County Executive Rich Fitzgerald here with Dr. Deborah Bogan for our regular update on COVID-19. As we enter March of 2022, it is now 2 years, almost to the day, the middle of March of 2020, when we entered this pandemic phase. It has certainly been a very challenging time as things changed over the last couple of years. Didn't have a vaccine for a number of months, and obviously the hospitalizations, the impact to over 3,000 people who passed away in Allegheny County, over 950,000 people nationally who have died due to the pandemic. And then, of course, the fact is the hospitalizations, the impact on families, the impact on our economy, et cetera, has been staggering in many ways. Dr. Bogan, who has weekly and biweekly given these results of events and recommendations coming from the CDC and the Department of Health and others who've continued to work, has some, her update today will, I think, present more good news. We see the numbers, they continue to come down, the case numbers, weekly case numbers, daily case numbers, average case numbers, et cetera, as well as hospitalizations and fatalities, all heading in the right direction. And then, of course, the vaccination numbers as we continue to get more people vaccinated. I believe it's over 966,000 people in Allegheny County who has had at least one shot, over 800,000 who have been fully vaccinated, and almost another 400,000 have been vaccinated as well as boosted, have a booster shot. So we're really doing well there, but we want to continue that because those numbers regarding vaccinations are absolutely startling, and Dr. Bogan will talk about those in just a minute. So let me turn it over to Dr. Bogan for her report. Dr. Bogan.
Thank you, County Executive. Good afternoon and welcome to our COVID-19 briefing. Last week, the CDC announced significant changes to its pandemic recommendations, and I just spent the better part of an hour at our Board of Health meeting reviewing the changes and what they mean for us moving forward. I'll provide a recap now, but if you want to see my full report, you can view the live stream of the meeting at the Health Department's Facebook page. On a quick tech note, you do not need a Facebook account to watch the live stream. Just go to facebook.com on the internet, search for the Allegheny County Health Department, and find our page and live stream recording. The CDC changes reflect the current pandemic phase. We've seen surges, variants, public health orders, the emergence of safe, proven, and effective vaccines and therapeutics, and many other developments. The current pandemic phase is different than previous ones, and as such, it requires a different approach. Many factors contribute to the change in response. First, many people in our county and country are vaccinated. Many people also have some natural immunity, especially following the large Omicron surge. We have effective medications to reduce the severity of illness for those most at risk for serious outcomes, especially if taken early in the course of the disease. And we have treatments for those with serious disease. So, in recognition of the changing landscape and resources, the CDC devised community measures that focus on minimizing the impact of severe COVID illness on health and society, especially preventing medically significant illness, focusing on minimizing the burden on the healthcare system, and focusing on protecting the most vulnerable through vaccinations, therapeutics, and COVID-19 prevention strategies. The CDC defines 3 COVID community levels, low, medium, and high, based on 3 indicators. The first indicator is case rates of less than or greater than 200 cases per 100,000 population over the last 7 days. The second indicator is the new 7-day total COVID hospital admissions per 100,000 population. And the third indicator is the 7-day average percent of staffed inpatient beds occupied by COVID patients. The COVID community levels inform recommendations for both what individuals can do to protect themselves and what community-level prevention strategies can be implemented. Whether or not the CDC recommends public indoor mask wearing depends on your community level, which you can check on the CDC website. If your county is in the low level, the CDC no longer recommends masking. When in the medium level, the CDC recommends you talk to your healthcare provider about wearing a mask, especially if you are a potentially increased risk. When in the high level, the CDC recommends you wear a mask in public indoor settings, including schools. Regardless of community level, I want to make it clear that people can always choose to wear a mask. By all means, if you want to, wear a mask. In all cases, if you have symptoms of COVID or were exposed to someone with COVID, get tested and wear a mask until you're sure you aren't spreading the virus. That will help us keep cases down in our community. Based on these new metrics, Allegheny County is currently in the low level. Our weekly report, issued yesterday, shows just how much the numbers have improved. In the past week, we had about 150 to 175 cases a day, a huge drop from the more than 3,000 cases a day in January. Positivity rates, hospitalizations, deaths, and levels of virus in wastewater have also decreased significantly. All good news. Vaccination is the leading public health prevention strategy for severe disease and death from COVID-19. In Allegheny County, as the county executive said, the majority of people are vaccinated, at least 70%. And vaccinations have been a game changer in this pandemic. I shared data at the Board of Health meeting today, which clearly demonstrate the power of vaccinations at preventing severe disease and death. And I'll share the highlights now. These statistics are eye-popping. In Allegheny County, the hospitalization rate for people without any vaccinations was 251 per 10,000 residents. 251 per 10,000 residents, compared to just 11 for people who were vaccinated and had a booster dose. The death rate for people without any vaccinations was 48 per 10,000 residents, compared to just under 2 per 10,000 for people who are vaccinated and had a booster. If you are not yet vaccinated, you are taking unnecessary risk. I urge you to get the facts. In this new phase of the pandemic, it's important that people use the information available from the CDC, from local public health agencies, and from your personal healthcare providers to make thoughtful decisions about individual behaviors and community prevention strategies. As your health department, we will continue to do our part to keep you informed and up to date. Very soon, we will publish 2 new COVID dashboards, one for vaccinations and one for wastewater surveillance. We will continue to publish weekly reports, track outbreaks, perform select case investigations, and monitor the data. I encourage you to use the data we report to make informed decisions for yourself, your loved ones, and your community. I am an optimist at heart, and I am optimistic that we have turned a corner. As we spring into the warmer weather, better days lie ahead. The pandemic is not over. There will likely be more phases, possibly new surges and variants, and you may be asked to wear a mask again for a limited time in certain settings. We don't know what the future holds, but we do know that the present looks much better than it did last month, and certainly better than it did in January. With that, I ask you to please be safe and be kind. Thank you for your time.
There were no questions submitted to the Health Department today by members of the media. So if you have any closing remarks, we'll switch to that before convening.
All right, I'll leave that to the county executive.
Well, thank you, Dr. Bogan, and those numbers are absolutely eye-popping. I think it's a great description of that, to know both when it comes to hospitalizations and fatalities. You are 25 times more, by my rough math, I did it real quickly, about 25 times more likely to be hospitalized or die if you're unvaccinated than if you are vaccinated. Also, those numbers that were in mid-January, around 3,000 per day, coming down to 150 to 175 per day, as that Omicron variant spread through this community very quickly for a month or so. It's very heartwarming to see that these numbers are coming down, and certainly we're optimistic that we'll continue along those paths. But as Dr. Bogan said, there will continue to be things that change, and we've seen that throughout these almost 2 years now of dealing with this pandemic. with COVID-19. Stay tuned from the CDC and the Health Department and all the information that will continue to come out. But for those of you, those few of you that haven't been vaccinated, please get vaccinated. Protect yourself, protect your families as we hopefully eradicate or minimize the effects that this pandemic has had on our families, our communities, and all of our lives. So we'll see you in a couple weeks, and God bless. Thank you.
Thank you for joining us. Our next regularly scheduled briefing is Wednesday, March 16th.